Good evening, everyone, and welcome to the Reset. I am your host, Andre Clay, and tonight we want to do a special broadcast because yesterday was Mother's Day. Usually we do air on Sundays at 4 p.m. on my Room at the Top Entertainment page and also on my Andre Clay slash YouTube page. Please be sure to subscribe and thumbs up those pages for more likes so we can get more exposure. But tonight was brought to us via a friend of mine who sent me a link to an article from the Associated Press. And I want to thank Janae for that. She suggested you have to do a broadcast about this. And so after reading the article and doing a little bit of research myself, I decided that, I think I will tackle this article. Tonight, if you don't mind, anyone who has comments, please feel free to chime in. We're going to get into this in just a minute. Tonight, I'm going to be trying to screen share because, as we all know, I'm kind of new to this software here. But we're going to start the show off. Get down here to the screen share. Make sure we can all see the screen. All right. First article up for today, everyone. Again, by the Associated Press, an exclusive docs show top White House officials buried CDC report. Now, as was deemed an essential worker, the job that I have, they've all required all of us to take safety precautions concerning this pandemic. We're all required to wear masks. We're all required to wear gloves. And we know that these requirements from our employers are constructed around the suggestions made by the CDC and the WHO, the World Health Organization. Now, also, in being an essential worker, as well as I am sure for many other Americans, we do try to stay abreast on White House briefings and any updated information that the CDC shares with the public. And we are aware of the White House actually ditching a CDC report that was supposed to outline some phases for the country to start up again. But apparently it was buried. And so if you give me a minute, let me read this article. The decision to shelve detailed advice from the nation's top disease control experts for reopening communities during the coronavirus pandemic came from the highest levels of the White House, according to internal government emails obtained by the Associated Press. The files also show that after AP reported Thursday that the guidance document had been buried, the Trump administration ordered key parts of it to be fast-tracked for approval. The trove of emails show the nation's top public experts at the Centers for Disease Control and Prevention spending weeks working on guidance to help the country deal with the public health emergency, only to see their work quashed by political appointees with little explanation. Now, the document titled, quote, "The Guidance for Implementing the Opening of America Again framework" was researched and written to help faith leaders, business owners, educators, and state and local officials as they begin to reopen. It included detailed, quote, "decision trees" or flowcharts aimed at helping local leaders navigate the difficult decision of whether to reopen or remain closed. White House spokesman Kayleigh I can't say this lady's name, McEnany, said Friday that the documents had not been approved by CDC Director Robert Redfield. The new emails, however, show that the Redfield cleared the guidance. This new CDC guidance, a mix of advice already released along with newer information, had been approved and promoted by the highest levels of its leadership, including Redfield. Despite this, the administration shelved it on April 30th. As early as April 10th, Redfield, who is also a member of the White House Coronavirus Task Force, shared via email the guidance and decision trees with President Donald Trump's inner circle, including his son-in-law, Jared Kushner, top advisor Kellyanne Conway, and Joseph Grogan, assistant to the president for domestic policy. Also included were Dr. Deborah Birx, Dr. Anthony Fauci, and other task force members. 3 days later, CDC's upper management sent the more than 60-page report with attached flowcharts to the White House Office of Management and Budget, a step usually taken only when agencies are seeking final White House approval for documents they have already cleared. The 17-page version later released by the AP and other news outlets was only part of the actual documents submitted by the CDC and targeted specific facilities like bars and restaurants. The AP obtained a copy Friday of the full document. That version is a more universal series of phased guidelines, steps for all Americans in every community, quote unquote, geared to advise communities as a whole on testing, contact tracing, and other fundamental infection control measures. Redfield weighed in publicly for the first time Saturday, issuing a statement that apparently contradicts his internal emails and supports the White House's assertion that he had not formally approved the guidance. He said in the statement that the CDC guidance was in draft form and had not been fully vetted. Quote, "This is an iterative effort to ensure effective, clear guidance is presented to the American people. I had not seen a version of the guidance incorporating interagency and task force input and therefore was not yet comfortable releasing a final work product." But on April 24th, Redfield again emailed the guidance documents to Birx and Grogan, according to a copy viewed by the AP. Redfield asked Birx and Grogan for their review so that the CDC could post the guidance publicly. Attached to Redfield's email were the guidance documents and the corresponding decision trees, including one for meatpacking plants. Quote, we plan to post these to CDC's website once approved. Peace, God blessings, R3, end quote, the director wrote. Redfield's initials are RRR. Redfield's emails contradicts the White House's assertions Thursday that it had not yet approved the guidelines because the CDC's own leadership had not yet given them the green light. Now, 2 days after this email to Birx and Grogan on April 26th, the CDC still had not received any word from the administration, according to the internal communications. Robert McGowan, the CDC chief of staff, who was shepherding the guidance through the OMB, sent an email seeking an update. "We need them as soon as possible so that we can get them posted," quote unquote, he wrote to Nancy Beck, an OMB staffer. Beck said she was awaiting review by the White House Principals Committee, a group of top White House officials. Quote, "They need to be approved before they can move forward. White House principals are in touch with the task force so that the task force should be aware of the status," Beck wrote to McGowan. The next day, April 27th, Satya Thalman of the OMB sent the CDC a similar response. Quote, "The reopening guidance and decision tree documents went to the West Wing Principals Committee on Sunday. We have not received word on specific timing for their considerations." Quote, "However, I am passing along their message. They have given strict and explicit direction that these documents are not yet cleared and cannot go out as of right now. This includes related press statements and other communications that may preview content or timing of guidances." According to the documents, CDC continued inquiring for days about the guidance that officials had hoped to post by Friday, May 1st, the day Trump had targeted for reopening some businesses, according to a source who was granted anonymity because they were not permitted to speak to the press. But on April 30th, the CDC's documents were killed for good. The agency had not heard any specific critiques from either the White House Principals Committee or the Coronavirus Task Force in days, so officials asked for an update. The guidance should be more cross-cutting and say when they should reopen and how to keep people safe. Fundamentally, the task force cleared this for further development, but not for release, wrote Quinn Hirsch, a staffer in the White House's Office of Regulatory Affairs, in an email to the CDC's parent agency, the Department of Health and Human Services. The administration had already released an Opening Up America Again plan, and the clock was ticking. Staff at the CDC thought it could get their reopening advice out there. It would help communities do so with detailed expert help. But hours later, on April 30th, CDC's Chief of Staff McGowan told CDC staff that neither the guidance documents nor the decision trees would ever see the light of day, according to three officials who declined to be named because they were not authorized to speak to reporters. The next day, March 1st, the emails showed a staffer at CDC was told we would not even be allowed to post the decision trees had the team, exhausted as they are, stand down. The CDC's guidance was shelved until May 7th. That morning, the Associated Press reported that the Trump administration had buried the guidance, even as many states had started allowing businesses to reopen. After the story ran, the White House called the CDC and ordered them to refile all of the decision trees, except one that targeted churches. An email obtained by the AP confirmed the agency resent the documents late Thursday, hours after news broke. Quote, attached per the request from earlier today are the decision trees previously submitted to both OIRA and the White House Task Force, minus the Communities of Faith tree, read the email. Please let us know if, when, or how we are able to proceed from there. Associated Press reporter Zeke Miller in Washington contributed to this report. Now, after reading this, I had two main questions. One, what was in that CDC report? The other, well, why was it shelved? Two questions that I pondered on all weekend. Now, what I decided to do was take a look at this report that the CDC shared with the public and were able to obtain. And if you give me a minute, I'm gonna go here. And the CDC document, hold on a second, guys, just a moment. There we go. All right, this is right here's the official document that the CDC had released to the White House. Give me a minute. Let me see if I can zoom on this and read a little bit of this for you. Now, as I went through the interim guidance, I noticed that, yes, indeed, they had different phases included in this guidance, suggested guidance for things like child care programs. As we scroll down, we have phases for interim guidance for schools and day camps. We also have interim guidance for communities of faith. We also have interim guidance for employers with vulnerable workers, interim guidance for restaurants and bars, and interim guidance for mass transit administrators. Now, in looking through the guidance that was suggested by the CDC. And I'll start off with the interim guidance for child care programs. The reopening of child care programs is crucial to helping parents and guardians return to work. Many states have closed schools for the academic year, and with summer quickly approaching, an increasing number of working parents may need to rely on these programs. CDC's interim guidance for administrators of U.S. K through 12 schools and child care programs and supplemental guidance of child care programs that remain open provide recommendations for operating child care programs in low, moderate, and significant mitigation communities. In communities that are deemed significant mitigation areas by state and local authorities, child care programs should be closed, excuse me. However, child care programs can choose to remain open to serve children of essential workers, such as healthcare workers. All decisions about following these recommendations should be made locally in collaboration with local health officials who can help determine levels of COVID-19 community transmission and the capacities of the local public health systems and healthcare systems. Now, as we take a look at this document, as I stated before, they do have each program, each interim guidance broken down into phases. With this particular phase, we read that in all phases, it is meant to establish and continue communication with local and state authorities to determine current mitigation levels in your community, protect and support staff, children, and their family members who are at higher risk for severe illness, provide staff from higher transmission areas, earlier phase areas, telework, and other options as feasible to eliminate travel to child care programs in lower transmission later phase areas and vice versa. Follow the CDC's supplemental guidance for child care programs that remain open. Ensure that any other community groups or organizations that use the child care facilities also follow this guidance. Now, in phase one, says here, restrict to children of essential workers in areas needing significant mitigation. Phase two, expand to all children with enhanced social distancing measures. Phase three, remain open for all children with social distancing measures. And each of these phases would go into play, subsequently after a period of time. Along with this, they go into the safety actions they believe should be taken in phase 1 through 3, promote healthy hygiene practices, intensify cleaning, disinfection, and ventilation, and ensure social distancing. I will provide a link to this document in the chat later on, but I definitely wanted for you guys to take a look at this document. And also, we have the tree or flow chart that was also sent to the White House along with this document. And here, if you ask me, they made it really easy for 4 or 5. They made it really easy for the White House. As we see here, and this is just another example, as I scroll down to the reopening child care programs during the COVID-19. If you look to the left, should you consider opening? Check. Is the child care center in a community no longer requiring significant mitigation? Will reopening be in compliance with state and local orders? Will the child care center be ready to protect children and staff at a higher risk for severe illness? They have the options. If the answer is no, do not open. And if yes, they go on with other recommendations to meet the safeguards that have in place. I'm not sure how simpler it can get for the White House to understand this flow chart. And it seems reasonable to me, very reasonable. It doesn't seem to suggest that anything is being forced on anyone. Um, and I found it unusual that the White House, despite this guidance, would okay the opening of states with the businesses. But this is America, and this is where we live, and we have to deal with this type of thing. Now, not sure about you guys, but this is worrisome. This is worrisome in the sense that there is still no vaccine for this virus. Still no antibody treatments for this virus. Many Americans are walking around thinking that they're healthy when in fact they could possibly be asymptomatic, meaning they may indeed have the virus in their systems, but because they don't display any of the symptoms, they think they're healthy. At my job, again, we are required to wear a mask and we are required to wear gloves. And this is for not only our safety, but also the safety of the public in which we for which we serve. This has nothing to do with anyone's personal feelings about whether or not we should wear a mask. It has nothing to do with whether or not one feels that gloves are necessary. It has nothing to do with whether or not one even believes that the coronavirus is serious. But it does have everything to do with public safety. And I tend to err on the side of caution when it comes to this, because again, the CDC, the World Health Organization, and the medical industry, they're not sure about how this virus spreads, how to stop the virus. But we do know that the shelter in place orders that have been implemented across the country have helped to curb the spread of the virus and in some cases lower it. The fear, however, is that by 47, I think, of our states that have decided to reopen, with that, the fear that the virus can, spread more rapidly is there, and that's understandable. It's understandable. But I do think that to err on the side of caution is the smarter way to go. Um, it's not about fear of government. For those of us who are essential workers, this is not about being controlled by the government. This is about public safety, not just for ourselves, but for you as well. Also, over the weekend, I also noticed on different websites and on Facebook that great concern had come about because on May 1st, our House introduced a new bill meant to be a part of the subsequent stimulus packages that the Congress is trying to pass for those of us who have not been able to return to work, who have been forced to stay at home and don't have an income. These stimulus packages, while I still believe they could be more and they can do a whole lot more for the American people, the Congress has decided that they would try to incorporate into the House version a bill that was just introduced that would assist in contact tracing. Now, on the internet, conspiracy theories were flying, and it's understandable because of the mistrust of this government. But I decided that too, I needed to take a look at, and that's what I did. What I plan to do now is screen share what that bill is, as opposed to posting it or instructing others to just go see it for themselves, which we all know is likely not going to happen. But if you so desire, if you would take a look at the screen now, you can go to congress.gov. I tend to go here quite often, as a matter of fact, to read certain bills that are going through our government, that are concerned to the American people. And I would also suggest that you do the same at your leisure. But here we have the text to what is called HR 6666. And if you don't mind, if you give me a second, HR 6666, COVID-19 testing, reaching, and contacting everyone, which is also referred to the Trace Act. The HR 6666 bill is to authorize the Secretary of Health and Human Services to award grants to eligible entities to conduct diagnostic testing for COVID-19 and related activities, such as contact tracing through mobile health units and, as necessary, at individuals' residences and for other purposes. Next in line in the House of Representatives, we have the 45 Congress folks who signed on to this. I believe this bill was spearheaded by Congressman Bobby Rush out of Chicago. And in this bill, it is broken down into different sections. Some of this particular bill, I decided that I'm going to read to you guys. Again, this bill has only been introduced. It has not passed through the House, and it certainly hasn't passed through the Senate, which for most of us don't believe that it will actually happen. However, Section 1, short title. This act may be cited as the COVID-19 Testing, Reaching, and Contacting Everyone Act, the Trace Act. Section 2, COVID-19 testing and contact tracing using mobile health units. A, in general, the Secretary of Health and Human Services, acting through the Director of the Centers of Disease Control and Prevention, may award grants to eligible entities to conduct diagnostic testing for COVID-19, to trace and monitor the contacts of infected individuals, and to support the quarantine of such contacts through mobile health units and, as necessary, testing individuals, providing individuals with services related to testing and quarantine at their residences. Now, before I go any further, one of the concerns, well, a lot of the concern that I saw over the weekend concerning this bill was that this bill would force anyone to be tested. And subsequently, had a lot of people decided they didn't want to take the test. But as I have read so far in this bill, it seems to be limited to those who are infected and those who are in contact with those who are infected. But let me go on. The permissible use of funds, which is a grant recipient under this section may use the grant funds in support of the activities described in Section A, which is 1, to hire, train, compensate, and pay the expenses of individuals, and 2, to purchase personal protective equipment and other supplies. When we come down to C, priority, in selecting grant recipients under this section, the Secretary shall give priority to 1, applicants proposing to conduct activities funded under the section in hotspots and medically underserved communities, and 2, applicants that agree in hiring individuals to carry out activities funded under this section to hire residents of the area or community where the activities will primarily occur, with higher priority among applicants described in this paragraph, given based on the percentage of individuals to be hired from such area or community. When it comes down to distribution, in selecting grant recipients under this section, the Secretary shall ensure that grants are distributed across the urban and rural areas. E, federal privacy requirements. Nothing in this section shall be construed to supersede any federal privacy or confidentiality requirement, including the regulations promulgated under Section 264C of the Health Insurance Portability and Accountability Act of 1996. In this bill, they do provide links to those bills that you're more than welcome to go check out for yourself. When we scroll down to F, definitions, in this section, one, the term eligible entity, which I'm sure is of concern to many, means a federally qualified health center, as defined in Section 186AA of the Social Security Act. B, a school-based health clinic. C, a disproportionate share hospital, as defined under the applicable state plan under the Social Security Act. D, an academic medical center. E, a nonprofit organization, including any such faith-based organization. F, an institution of higher education. G, a high school. H, any type of entity that is determined by the Secretary to be an eligible entity for purposes of this action. 2, the term emergency period has the meaning given to that term in Section 1135G1B of the Social Security Act. The term hotspot means a geographical area where the rate of infections with the virus that causes COVID-19 exceeds the national average. The term medically underserved community has the meaning given to that term in Section 799B of the Public Health Service Act, which you can go see. 5, the term secretary means the Secretary of Health and Human Services. Now, G, authorization of appropriations. To carry out this section, there are authorized to be appropriated $100 million for fiscal year 2020 and such sums as may be necessary for each of fiscal year 2021 and any subsequent fiscal year during which the emergency period continues. And that's our HR 6666 bill, read in its entirety for you. Now, as we go back to the broadcast, I don't know about you, but I saw nothing, read nothing that would suggest that anything is being forced, not in this House version of the bill. Again, this House bill is only a suggestion. It has not passed through the House yet, nor has it even reached the Senate yet. But it's definitely causing a lot of stir up for a lot of us around the country. Again, as an essential worker, we are dependent upon the reports made by the CDC and the WHO, regardless of our personal feelings about them, regardless of whether or not we trust them, whether or not we believe that this is a big plot done by Bill Gates to do a mass vaccination of the world populace, or to even reduce the world populace. But it is, in my opinion, we still need to take these safety precautions seriously. It doesn't matter whether you think this is real or not. Doesn't matter whether you believe we should be wearing face masks or not. It just doesn't matter. COVID-19 is killing people. and every precaution, again, needs to be taken. I hope that this broadcast tonight was informative for you. And please do take the time to go to congress.gov to read up on some of these bills that you hear some of the political pundits and news reporters speak of, and also those posted online. A lot of misinformation is out there about the bill. A lot of misinformation is out there about a lot of this whole fiasco with the coronavirus pandemic. But I'm going to log off for now. Hopefully, again, this information was of help to you. I will save my personal opinions about any of this, as well as any of the other opinions out there, for another broadcast. But be sure to, again, click like on the Room at the Top Entertainment Facebook page, and check us out on Andre Clay YouTube. Thanks again for everyone for chiming in. Thanks again for tuning in. Good night.